Dr. James Chen is back to look at a pair of players who are recovering themselves and could be back on the field in the coming weeks. Gentlemen?
I need both of these guys in separate leagues, so there's a little bit of wish casting on my part here. I want you to give us a pep talk on both of these players. I want to start with Greg Olsen, who suffered a Jones fracture. We're kind of familiar with that over the past couple of years. It's one of the major injuries that we talk about, foot injuries that we talk about around here. He's going to return to practice. We're hearing noises that he might be back in week 12. What do you think?
So he did have a Jones fracture. You can see him here on his crutches and his fracture boots. I have an x-ray of what the Jones fracture would actually look like, and you can see here there's a crack in his fifth metatarsal. And this is the actual surgery on this side that would be performed, where you put a screw up the metatarsal shaft. Now, bones typically take 8 weeks to heal. The NFL has a lot of data showing that for this fracture, it's probably 10 weeks on average for return to play. Earliest would be 6 weeks. I still think he's a week 12 return. The reason I say that is there's been a lot of players in past seasons who've taken a long time to get better. Des Bryant missed 7 games in 2015 for this. Julio Jones missed 11 games in 2013 for this. And last year, Sammy Watkins had the surgery early in the season, and it just nagged him and nagged him. So, you know, I'm thinking week 12 or more before he's game ready.
And are there, now this is obvious, we're not talking about a young player here, are there long-term concerns with this injury as well?
Well, several of them have had 2 surgeries. So Julian Edelman had to have a second surgery. Des Bryant had to have a second surgery. The caution is if you come back too soon, even if you can play on it, you might need to have something done later. So it's definitely better to be more conservative here.
Oh, okay, let's transition to what is going to be one of the feel-good comeback stories, right, of the season. Teddy Bridgewater suffered a pretty horrific knee injury, right? It was at least an ACL, a dislocation, probably multiple ligaments. How do you feel about his comeback?
Well, you know, the rumor is that he's starting to practice and taking some snaps in practice. Here's a picture of, you know, him practicing. This was an injury in early 2016, and he had a knee dislocation. Now, this is a very serious injury to have. You can see from this x-ray, here's his thigh bone, or a thigh bone, which should line up with the tibia.
Yeah, that's
so
wrong.
You know something's wrong here. Now, the reason that this is severe is because behind the knee, there's your artery and your nerve. If you damage those, you can sometimes have permanent loss of function. Now, in order to dislocate your knee, you have to injure at least 2 ligaments in your knee. So your ACL and potentially your MCL here. Now, the recovery from something like that, because you need multiple surgeries, can take a long time. These are the type of surgeries that you would have. This is an MCL repair where you're putting 2 anchors in the MCL and using what's called an internal brace to repair the MCL. And I have a video clip of what an ACL surgery looks like, where you pass a graft up through some sockets that you drill, and then that's the new graft that's going to be your ACL. Now, if you have a 1 ligament injury, you can have a full return after 1 year. But when you tear 2, it's definitely more cautious. I think this is position dependent. If he were a running back, I would say, you know, I would be very cautious about him returning. It's been long enough and the ligaments are healed. So from my perspective, he's just going to have to test it out and see how he does.
Right.
I think if he could adjust to being more of a pocket passer and less mobile, I definitely don't think he's going to be as mobile and probably not be able to take the hits like he could before. I mean, I'm certainly rooting for him, but I would. This is one where it's a wait and see, and I'd be more cautious about.
It's a feel-good comeback if it happens, and if he leapfrogs Case Keenum, he's got a great receiving core at his disposal.
All right, thank you both.